So guys, it's time for me to get dressed for work. So guys, I'm here at my patient's house, and I've been with this patient for a long time now. So usually if it's a patient that you've been handling for a long time, the parents would usually give you just a key to the house so you can just get in the house. But if it's a new patient that's assigned to you, what I usually do is call prior to the assignment and tell the parents that, hey, I'm here, I'm assigned to take care of your child for the day, and it's going to be like that. It would sound like that. And I usually come 15 minutes earlier. So right now it's 6:45 a.m. My shift starts at 7 o'clock, and I just wait a little bit, and before I leave the car, I make sure that it's parked properly and it's safe, because with home health care, you're assigned to different patients, and safety is very important. You wouldn't want somebody to be like doing something with your car, so you make sure you're in a safe place, and you have to lock your cars and secure it, and also not leave anything inside your car. You have to take especially important belongings. You cannot leave it in your car. You have to take it with you inside the house. So guys, I have to stop here because blogging and using the phone inside the house is not appropriate. So see you in a few minutes later. So guys, I'm taking you to work. I'm now at my patient's house. So I already received report from the parents, and it's going to be a normal day for me because they said that the patient has no issues. So I usually start by making the patient comfortable and taking the vital signs, doing physical assessment, and I give the daily routine scheduled therapy, which is chest precaution, and together with um, breathing treatments. And I always check the equipment, making sure it works because sometimes they don't charge it. So I keep it plugged in as much as possible. And even if the parents would say that the patient is okay the day before or that night, I would not be complacent. So each time I do something like any care or intervention, I would always document it right away. That way I wouldn't forget anything, and especially reviewing the MAR for new orders from the doctor or any changes in medication. And I clean the surface where I prepare the meds. That is really important too. And I make sure that the medications are all available, the feeding supplies, and review the MAR and compare it with what's available, and check the expiration date of the feeding supplies because this patient that I have right now has a G tube and needs to be G tube fed for 4 times during my shift. And if, for example, if this patient now would have difficulties breathing or shortness of breath, then I would be giving also breathing treatments in between. And all the scheduled meds I have to give on time. And um this patient, the G-tube feeding is slow, so it's by bolus and not by a feeding pump. And um she cannot really tolerate the feeding sometimes, and she sometimes has a problem with tolerating the feeding. So I really slow feed it for 1 hour, and I make sure that she's sitting up on her bed so that she won't aspirate. So slow feeding really takes time, guys, but I'm patient enough to do that because it's needed, and I don't want to be like her vomiting and it will be messy. And in between, I suction her if she has increased secretions. I provide G-tube care, cleaning the site, and also tracheostomy care. And we have time to play. This patient is also like has a problem and afraid seeing a doctor. So every time she sees a doctor, she cries a lot and she gets agitated. So I kind of try to make her comfortable by showing her how to do tray care and G-tube care using a toy, like a stuffed toy. So I usually use Olaf because the snowman, if you have heard snowman, the frozen Olaf, that's the stuffed toy that she really likes. And there are times I have to really be animated, and this patient is nonverbal. So I also try to make her talk by saying a few words. So part of my job, I coordinate with a speech pathologist or a therapist, and I also coordinate with occupational therapist and a physical therapist. So we work hand in hand um, to help this patient. So I also try to introduce to my patient some toys that are age appropriate. That is like in their developmental milestones. So during the day, I would check everything, report to the caregiver. I make sure client is safe all throughout the shift. All medications are given. So that's it, guys. So it's the end of the day, end of the shift. Now I'm heading home. Guys, I'm home.
Hi,